My name is Andrew Grossman. I have an MD degree from New York Medical College, and I'm board certified in emergency medicine. Now, there are a number of underlying factors that are that you cannot avoid. There are genetic factors, which are very common. At least 30% of diabetics, probably more, have this propensity for high sugar due to their genetic predisposition. Other causes and contributing factors are behavior, diet, level of activity, level of exercise in the course of a certain amount of time, such as a week, how many hours of moderate to high intensity exercise that we do, our diet, which may be high in high calorie, low quality foods, such as processed foods, cakes, ice creams, things that are high in fat and sodium, and of course, sugar. An overabundance of sugar, which causes a surge in insulin, causes the pancreas to overreact, which causes other problems, and also can lead to a burnout of the pancreas. And sugar is okay up to a certain point, but refined sugar, of course, causes a surge in sugar, and that causes a surge in insulin production by the pancreas. It causes, there are theories that causes burnout of the pancreas and early stage onset of diabetes. There are two types of diabetes. There's type 1 and type 2. Type 1 is a complete loss of insulin. The presentation is different than an emergency due to type 2 diabetes. Type 2 diabetes is diabetes where the insulin is not quite, it's not 100% absent. It's usually due to resistance to endogenous insulin. And this resistance occurs when patients are overweight, excessive amount of fat. Also occurs with inactivity. And of course, there are things that are genetic. You have less insulin, more resistance. That's type 2 diabetes. Glucose should run somewhere around less than 130 and above 80. That's a normal glucose, which is asymptomatic. We want to get it down a little bit lower because over time, high blood sugars can lead to other problems, such as atherosclerosis, coronary artery disease, hypertension, strokes. So we want to get it down to a decent level. First degree or second degree family members who have diabetes, and that would indicate that you have a higher risk for diabetes. The most important nowadays parameter is the A1C level, which should be less than 7. A1C is a glycosylated hemoglobin. Try to keep that level below 6.5. We do that by creating a modality of treatment whereby the patient's blood sugar stays at 100, doesn't go up, doesn't go down, and doesn't have hypoglycemia, which has acute effects that are not good for the brain and the heart and the rest of the body. So we want to find a level where we don't see hypoglycemia and we don't see elevated blood sugar above a threshold. We want to keep the blood sugar, the more stable the blood sugar, and the more it stays within that range, 100 or 105, less than that, probably over 80 to 90, the less likely down the road we're going to have these secondary problems. Food is better and safer than some of the processed, low quality, high calorie foods. A lot of processed foods are enhanced for flavor. Companies that create these foods want people to eat the foods and want more and have cravings, so that they would buy more of these foods, which is good for the company, bad for the patient. It's important, if you're going to have carbohydrates, that you have high complex carbohydrates, such as starches. A potato has starch in it, for instance. It's a vegetable. It's a naturally occurring vegetable. And the type of sugar that it has is a starch. And these things get broken down slowly so that you don't have this acute surge of sugar. And an acute surge of sugar is not good for the pancreas. Fructose is a type of sugar. Sucrose is a type of sugar. Glucose is a type of sugar. Fructose is fine. As a matter of fact, sucrose is made up of fructose and glucose. So fructose is in fruits, and it's a lot better for you. Of course, anything you can overindulge in just about anything. So too much fruit. It's important to eat a balanced diet, to have a balanced diet, and to understand nutrition. It's important for patients, especially patients who have diabetes, to understand nutritional value of foods and the types of foods and what the nutritional aspects of those different types of foods. A well-rounded diet comprised of natural food, a moderate amount of intake is important. Obesity leads to insulin resistance, so you want to stay within what's considered a normal weight. Fat can be converted to sugar. An excess amount of fat can cause insulin resistance. And of course, fat can be converted to sugar. It's a form of energy. And fat is a way that the body stores energy. Also, fat is an insulation for people who live in cold areas. Underneath the skin, young people, for instance, have a layer of fat, which it's not a bad thing. A certain amount of fat is important. A lot of the substances that we talk about that are bad for you are only bad because we eat too much of these things. So you want to limit your sugar. You want to limit the amount of food that you eat to a point where you don't have more intake than output. The body will use sugar first, fat second, and protein last. If it has to utilize a person who is starving, for instance, who has utilized all of their fat, will start to consume muscle. And you'll see that in patients who are severely malnourished. You'll see how skinny they become, how the muscles atrophy. Fats and proteins, a lot of these things are converted in the liver to glycogen. And glycogen is the way the liver stores glucose. And that glycogen gets broken down when it's needed by the liver, and it allows for the body to regulate sugar in the bloodstream at a constant rate. A newborn baby whose liver is not developed can have periods of hypoglycemia, and that can be symptomatic. A baby who comes out who's lethargic, possibly comatose. Alcoholics who have cirrhosis of the liver will present hypoglycemic sometimes. Alcohol ketoacidosis, which is similar to diabetic ketoacidosis, which is an acidosis that's produced from breakdown of fats and proteins and sugars. Cells, except for the brain, the cells are able to utilize different substances and can also convert sugar or convert fats and proteins to sugar. They can also do that and utilize them that way. The liver can do that. A sugar that's not well controlled will lead to storage of fat, and for other reasons, and the exact mechanism is not completely understood. But if the sugar is not well controlled, over time, 10, 20, 30, 40 years, these people will develop early atherosclerosis, early coronary artery disease, early strokes from atherosclerosis of the carotid arteries in the neck. There are multiple underlying causes related to uncontrolled blood sugar. Now, this is different from what we see in the emergency room. In the emergency room, we might see a patient who's in what's called diabetic ketoacidosis, where their body is acid. That's not good for the kidneys, it's not good for the brain, it's not good for the heart, and it causes acute problems that have to be corrected. And in the emergency room, we're more concerned with correcting the blood sugar because the patient is now in an acute state of decompensation. So there's a way to treat that in the emergency room, it's different from the way we treat it in an office setting. In an office setting, we want to regulate the sugar so that over time, if you look at the average sugar, the average sugar level in the blood over time is normal, and that's correlated with better health over time. In the emergency room, we treat the acute symptomatology for the patient's acute situation. We might send the patient home with a blood sugar of 180 or 150, as long as they don't have any signs and symptoms secondary to that. They can go home, and if they're educated, and it can be treated at home. In the office, we want to keep the blood sugar more normal, like anywhere under 105. There are ways to screen for blood sugar. We get an initial A1C. And of course, we want it to be under 7. If it's over 7, then we suspect that the patient has some sort of underlying diabetes. We look at the fasting blood sugar, which should be under 105 and above 80 milligrams per deciliter. An age time-tested test called the glucose tolerance test, where the patient comes in fasting, is given a known sugar load in a drink, drinks the whole thing, and we get a baseline blood sugar. We wait 2 hours and we get a blood sugar. And if the blood sugar is above 200, then we're looking at a patient who's either pre-diabetic, has a propensity for diabetes, or is an overt diabetic, in which case we begin modalities of treatment. Behavioral modification is very important. There are other things that can cause diabetes or can contribute to diabetes, such as lack of sleep, stress, which influences also diet. As an emergency physician, I know all about this because I've spent many sleepless nights in my lifetime. And the way I counteracted that was when I got off of duty, I would exercise, and I would try to stay away from the foods that I ate in the emergency room. And I have to admit that my lack of sleep sometimes caused me to eat a lot of junk food. Insulin is probably a final resort as far as medications are concerned. At this point, we have so many different modalities of pharmacological treatment that we don't need to put patients on insulin. There are medications that are less likely to cause hypoglycemia. In the past, we had the sulfonylureas, like glibuside, could lead to hypoglycemia and had very long half-lives. Now we have medications that are much more tailored to the patient's specific conditions and are less likely to cause hypoglycemia. Ozempic is what we call GLP-1, and what this does is it decreases absorption of sugar and fat. It also decreases the appetite, increases energy, do more activities at the same time. You're not as hungry, you don't have as many cravings, and you tend not to take in foods that are not good for you. Coupled with education and counseling can help. There are other medications that we use also, such as metformin, which is a very common one that we use, and which it has an early threshold for use because it's relatively safe. It does have its side effects, but it is relatively safe, and it's very unlikely to cause hypoglycemia.
So, is there anything else that we didn't talk about that you want the world to know?
Yes. I don't know how to use those things. So all those buttons, I just want to press them all.